My name is Scott Sheffield. I'm on the executive board of the Transylvania Partners for Democracy, the sponsor of this event tonight. And you can see information on the screen here about Transylvania Partners for Democracy. I'm just going to read our mission statement so you'll know where we're coming from. Transylvania Partners for Democracy is a nonpartisan alliance of citizens committed to protecting our constitutional democracy from political extremism and authoritarianism through education, conversation, and political advocacy. If you'd like more information on our organization, you can get that at the table over here where we have more information about us, or you can visit our website. If, after learning about our organization and tonight's presentation, if you'd like to become a member of our organization, you can do so by filling out a membership form on the table or going to our website and filling it out there. Okay, so let's get started. Tonight is the TPD's third forum of 2025, aimed at informing and discussing a pressing national policy issue, and in particular, its local effects with citizens of Brevard and Transylvania County. Our first forum was Protecting Our Veterans and Our Forests. That forum was held on Monday, April 28th. From that forum, we created a petition, a Save Our Forests petition. We have copies of the petition in the back of the room or on the table over here and on our webpage. We invite you to read the petition and, if you are so inclined, to sign the petition. Our next forum was on the threat to American education, public and private. That was in May, on May 28th. A fact sheet on this topic is available at our table and on our website, and a video recording of that forum is available on our website as well. As a result of that forum, we also created a petition to save our schools. A copy of that is over there with a QR code on it, and it's also available on the webpage. We invite you to read and sign that petition as well if you are so inclined. Tonight's forum is on the uncertainty of healthcare in Transylvania County, another extremely important topic of grave concern to many in Brevard and Transylvania County. And to introduce the topic, I will turn it over to another member of the executive board, Dan Carter.
Well, I'm going to make this as brief as I can, since you're here not to hear from me, but from the panel that we've put together. But it might be useful to sketch out some of the highlights of the changes that the Great Big Beautiful Bill and other administration policies have made in healthcare in the last 7 to 8 months. I would urge you, if you're interested, there is a very dense 2-page description of some of the most important changes that have been made. We're talking about something that's constantly in motion because, as you know, things do change from day to day in Washington there. So let me very quickly run through this. The first thing that we're often focused on, and rightly so, is the major reductions in Medicaid and CHIP funding. They reduce Medicaid and CHIP funding over $1 trillion. It's hard to even get our head around that amount over the next 10 years. Now, those who justified the bill, the White House, the Republican majority, claim that this is not going to affect deserving recipients. The money's going to be saved by barring undocumented immigrants from receiving Medicaid, requiring recipients to work a minimum of 80 hours a month, and eliminating waste and fraud. That this will take up that $1 billion, I guess it is. $1 trillion. It's not, of course. As many of you know from following the news, President Trump said on at least 2 occasions that there was more than $140 billion a year in Medicaid and Medicare fraud. I don't know where he got this figure from. I've never seen it anywhere else. White House Speaker Mike Johnson, being a little more careful, said it was $50 million in Medicaid fraud. Whether this was an intentional decision to distort the facts or simply ignorance. Doge certainly didn't seem to understand the issue here. When they talk about $50 billion, that is actually the error rate up or down in payments. Often it involves the most minor kinds of clerical errors. It is not in $50 billion in freight. It is still significant. About 12 billion is the estimate of fraud. This is less than 1% of the expenditures for Medicaid. So the other thing to remember about that is that the fraud is overwhelmingly on behalf of providers. It is not recipients. The estimate is that less than 2%, 1 to 2% of the recipients are engaged in fraud in the amount that they're talking about losing. So it's actually not the individuals who are receiving it. Now, we do know from numerous studies, mainly the most intensive was by the Congressional Budget Office, which is a kind of gold standard, but there have been several other studies that say essentially the same thing. Can't measure precisely. Anywhere from 12 to 16 million Americans will lose health care and lose their benefits, not just on Medicaid, but because of the cuts in the subsidies for the Affordable Care Act as well. So, now, how does this affect Transylvania County? There are over almost 5,500 residents of the 34,000 people who live in this county are covered by Medicaid and CHIP, which is a children's health insurance program. And this was something I didn't know. I did know that despite the expansion of health care coverage under the so-called Obamacare and under programs that have been adopted, this county has 2,400 residents who have no health insurance whatsoever, and that is well above the state and national average. But the consequences may be far worse. Most of you are, I'm sure, aware that we expanded Medicaid to this in North Carolina in 2023, but that expansion explicitly says in the bill that if the federal government's contribution to Medicaid drops below 90%, it was 91% then, that it would be terminated in North Carolina. It's now 80%. And the legislature is going to have to deal with that, and it will require, according to Senator Tom Tillis, that well-known left-winger, that it will require $32 billion over the next decade. The state of North Carolina is going, if they're going to continue Medicaid, they're going to have to come up with $32 billion. Now, the other aspects of it I could mention. One of them that I think is important for this, the oldest county in North Carolina in terms of average age, and that is nursing facilities. Here and in many rural areas in the state, the large percentage of nursing homes are supported by Medicaid, and that the cuts that have been carried out or are being carried out will be carried out. That Brown University School of Public Health estimated that as many as 600 health nursing homes will close over the next 2 years. And as I said, the last point I'd make is that we cannot know what the absolute effects are, but the best estimate is at a minimum, and actually I said it's the minimum, it could be far greater, is 51,000 premature deaths every year because of the changes that have been made in the program. Thank you very much, and now let's hear from our panelists.
Good evening. Thanks for the wonderful turnout. Very good to see you here. I'm Terry Decker, and I'd like to introduce our panelists for this evening and also explain kind of the the way we work. You'll hear from each of the three in succession, and then we'll be taking questions from the floor. You could get some cards. You got them maybe when you came in. If you have a question, I recommend that you write it down as it comes to you instead of trying to remember it later. And just hold it up. And we have a couple of runners. You can see them raising their hands back here, Brian and Mark. They'll collect your questions, and they'll bring them up here, and I'll do some collating and whatnot in case there's redundancy and that sort of thing. If you run out of cards, run out of questions, raise a hand and get another card. That's all right, too. All right? So looking forward to this evening very much. Introducing our panelists from right to left, and that's the order in which they'll speak. On the far right, your far right, Dr. Richard Hudspeth is the current CEO of Blue Ridge Health, a nonprofit community-based health organization headquartered in Hendersonville and over a dozen locations across Western North Carolina. Dr. Hudspeth joined Blue Ridge Health as Chief Medical Officer in 2015 and became its CEO in 2016. He completed his BA at Duke University and his MD at University of North Carolina School of Medicine. In the middle here, Rik Emaus is a retired physician and healthcare executive. Having served as chief executive of two medical groups of over 200 providers each, he has extensive business and healthcare experience. He is certified by the American College of Physician Executives and has a master's in medical management from Carnegie Mellon University. Last but not least, Andrew Jones is an investigative journalist with the Asheville Watchdog, with a special focus on healthcare, including its quality and ease of access. He previously covered Buncombe County government and healthcare at the Asheville Citizen-Times. He's originally from Indiana, where a lot of great people are. I'm from Indiana as well. So without further ado, Richard, please.
Slide this over. Good evening. Wanted to make just a few minor corrections to the introduction. Thank you. So I've been a family physician in Henderson County and serving Western North Carolina for over 20 years. The past 10 years, I've been the CEO up until today. I stepped down, or asked to step down back in December, and that finally happened. The last piece was we needed the federal government, our overseeing agency, to approve the change in that position. So here I am, my first day of retirement, spending my evening with you. As a family physician, healthcare has been extremely important for me as in our community health. I also wanted to mention that Blue Ridge Health is in 9 counties across Western North Carolina, as far east as Rutherford and as far west as Swain County, and counties all in between. We generally have around 250,000 medical visits, over about 52,000 individual patients that we serve. We do primary care, specialty care, pharmacy, a lot of behavioral health, dental as well, mobile dental clinics. So we cover a wide swath of geography, and we also do a lot of services for patients. And healthcare is extremely important to me as a physician. I have the task of sort of giving you this overview of what it looks like with all of these things happening in our healthcare and Medicaid space. So I'm going to have mostly an overview with a few kind of little deeper dives, and then we're going to hear a bit more deeper dive on some of these topics from our other two panelists. So for this presentation, I would like you to go back to 1912 and think of the Titanic, all right? Titanic's going along. It's a beautiful, right? Beautiful ship. But I want you to think differently than this luxury liner. I want you to think about a life raft out in that ocean, a lifeboat, all right? And that lifeboat is very basic, all right? No luxury cabins. It has essential items for you, and it holds an awful lot of people, an awful lot of people. North Carolina, that lifeboat holds over 3 million people. And these folks are some of our highest at risk. Our kids, our pregnant women, folks in our residential facilities, and other adults who don't have access to any other health care. So this lifeboat is Medicaid, and it literally is the lifeline between life or death for some people. I want to tell you, so as we think about the Titanic or this lifeboat, non-luxury cruiser, I also want you to think about an iceberg. And we all know what you see on the top is the tip of the iceberg. What we don't know is what's underneath. How big is that iceberg? So I'm going to use that analogy to talk about where we are today. So what we know today and what we see today is the tip of the iceberg. And the first thing I want you to be aware of, outside of what I call the bad bankruptcy bill act that we have, what I want to talk to you about is that there are already cuts coming October 1st to Medicaid. $319 million has to be cut from the budget for Medicaid. 70% of that is going to land on providers. There are going to be 3%, 8%, and 10% cuts to providers. The PHPs, or the prepaid health plans, i.e. the insurance companies, have a maximum cut of 1.5% to their capitation rate. Now, you may not think, okay, 3%, 8%, 10%. That varies. Hospitals are 10%, behavioral health outpatient 8%, safety net providers like a community health center is going to be at 3%. There's nothing in this country right now that our prices are going down. 70% of our payroll are people. So when we take cuts, what does that mean? That means it's harder to retain people, right? And when you make cuts in a system like Medicaid, what you're going to see are fewer providers interested in providing access for these patients. And you're going to see eligibility changes as well regarding those changes. So that's happening right now, October 1st already. Another program that is being shuttered is what's called the Healthy Opportunities Program. Anyone hear of the HOP program? All right. That was $650 million over 5 years. And it provided evidence-based non-medical intervention, like food, giving people food boxes that didn't have access or enough money to get food, or to provide housing, for example, respite care in homeless shelters. That's all gone. At this moment in time, there is no ability or interest, as far as I can tell, to renew that program. So that is gone. We also, related to this bad bankruptcy bill act, there are two things that are happening related to that. The first is, you may be interested in this, is that the Congressional Budget Office mentioned or has estimated that Medicare will have to take Medicare, not talking about Medicaid, Medicare will have to take $500 billion in cuts. And that is known as a pay-as-you-go scenario. It's called sequestration. Because they're over budget, automatic cuts have to happen. And most of these cuts are going to happen in sort of these mandatory spending programs like Medicare. So that will start January 1st, unless something changes, with at least a 4% cut. And that 4% cut will continue for the next 10 years. Every year, another 4% cut. Another year, every 4% cut. That will happen in January. Also, this is sort of the ACA, the Affordable Care Act, death by 1,000 cuts. So what's going to happen here now is they're going to reduce enhanced subsidies for that program. They're already changing the eligibility for that program. So people that will be able to get in, they're actually shortening that window to get in as well. So we're going to lose people off of that program as well. There's also another program, SNAP, which is the Supplemental Nutrition Assistance Program, $490 million. So what's happened is the federal government has reduced their payment to that program. The state has to pick it up. If the state doesn't pick it up, it's an all or nothing thing, right? So if the federal government says we're going to do 85%, the state of North Carolina cannot say, okay, we'll be happy with 85%, we'll reduce to 85. It's all or nothing. You're not going to make that 490 million, it's done. That's what we're facing. This is the tip of the iceberg that we see at this moment in time. The other thing that I wanted to talk to you about, and I think we're going to hear more about this perhaps around our rural hospital discussion, but the Rural Healthcare Provider Fund, all right? So a lot of that's when they cut so much money from rural hospitals, they threw us a bone, and they're going to give $50 billion across the United States. That barely would cover all of the money that North Carolina loses. So we're going to get up on the short end of the stick, and I'm sure we'll hear more about that in depth here in a moment. But I also want to talk to you about, because these are going to happen very quickly and have to be done as well, our work requirements. We've probably all heard about, hey, people who are on Medicaid should work, right? So I want to tell you from my perspective as a physician, right? I think earlier he had the word deserving recipients. I will tell you, never in my 3+ decades of care has anyone ever come to me in pain or in need of my services who has been undeserving. That kind of language, to me, is deeply offensive. And I also want to tell you a story of a patient that we have served in Blue Ridge. I think it covers a lot of pieces about what we're talking about. You get a sense from language like that, right? That who we're helping is not who we're really truly helping. So here's an individual, had severe childhood trauma, left home early as a teenager. We're talking about in Western North Carolina. Left home as a teenager. Immediately when he left home, he was homeless, he had no transportation, no job, no health insurance, and yet he had severe trauma, anxiety, depression, had lack of trust issues, had poor communication skills. He got into our program. We were able to, number one, help him get housing. We got him transportation, a bicycle, right, rather than walking to work. We helped him find a job through our supportive employment program, which worked with businesses to hire folks like himself, and we would actually work with the business and the client in order to make sure that he and that workplace could develop the skills in order for him to succeed. And succeed he did. He is now in consideration for being now a supervisor, which would actually now, so he did get Medicaid through Medicaid expansion, but now that he's going to actually be a supervisor, he'll be eligible for health benefits through this company and not Medicaid. That is a hand up and not a handout. That's what Medicaid does. That is the lifeboat of Medicaid. So underneath, so now there's the tip of the iceberg, and now here is this big mammoth piece of ice that we can't see. And the problem that we have is messaging, right? Because a lot of people don't understand. Why is it under the surface? Because a lot of this stuff won't happen until after the midterm elections. How do you convince someone you can't see what's under that tip of the iceberg, but it is extremely dangerous? So, what do we have? Rural hospitals. Losing in North Carolina, rural hospitals going to lose $3.7 billion right off the top. I don't know if you realize what they're doing, and Tom Tillis was mentioned earlier, pointed out, rural states are going to be affected by these cuts more than urban areas. North Carolina has the second largest rural population in the United States behind Texas. It has the largest rural population per capita than any other state. We are a very rural state, and we are going to be dramatically affected by these cuts. When I say we, our people who are dependent, our 3.1 million people who are dependent on Medicaid. Eligibility changes are happening. There are also crazy things, there's this, healthcare is very complex. And there's this concept of provider tax, right? And we can talk about it later if somebody has a question about it. But essentially, that's going to cut $22.5 billion out of our system to collect money in order to help us run our Medicaid program. So that's also a problem. The other is that there are these things called state, excuse me one second. Can't even read my own writing. That's how I got into medical school. So, state-directed payments, sorry, excuse me. And these are things that allows the state to think differently about how they can make up for gaps in healthcare. Some of these things are going away. We have a healthcare access and stabilization program, which generally helps rural areas and rural hospitals. $6 billion, gone, just like that. Not likely to come back. So you can see that this iceberg underneath the surface is getting bigger and bigger. Then let's talk about the big one, $1.3 trillion coming out of Medicaid. This is what will happen if nothing changes by the next midterm. So as was mentioned, we're going to have roughly somewhere between 10, 12, 16 million people kicked out of that lifeboat out there to figure out how to get health care without health insurance. There's one other piece I want to mention, and that is they're also changing eligibility and definitions. They're changing a definition of what is considered a public benefit. So what's important is healthcare has generally been excluded from deciding whether this is a public benefit or not. That is, anyone could get care and not be considered using a public benefit when it's healthcare. They're taking away that definition. So anyone that comes to our clinic will now 100% have to be proven to be a resident or eligible for Medicaid or will have to be shown to be a citizen in order for us to take care of them with sort of any federal dollars whatsoever. Again, as a physician, I find that deplorable. I mean, how is anyone asking anyone in healthcare to say we're not going to take care of you, even though you're right in front of us and you need help? Can't be done, right? But these are the things that are going to happen under this big iceberg that we are seeing. So I thank you for your time, and I'm going to let Rik talk about kind of the deeper dive of things. There you go. Thank you.
So I don't have a starter like Dr. Hudspeth had, by the way. That caught me off guard. Congratulations on your retirement. And I know without a doubt that you will fail retirement as miserably as I have for these past 8 years. I absolutely know it. So welcome. Welcome to the Failed Retirement Club. So Rich and I have a few things in common. We both started our careers as family docs in training and found ourselves in a position where we were drawn into leadership in healthcare. And I suspect, I haven't confirmed it with him, but probably very similar motivations. When you are drawn into leadership as a physician, you're pulled by two forces. One is to try to help a very unpredictable, chaotic, complicated system be kind and compassionate to the people you try to treat and attempt to make their lives better. And two is to help make that journey survivable for your care team members. That was my job as I understood it when I led medical groups. So I learned a lot of things about payment systems and a lot of the things that Dr. Hudspeth talked about. Since retiring and moving here in 2017, I learned a lot from the community side, looking outside of a system in. I intentionally let my license lapse. I said, I don't want to be inside the walls, inside of the system, but I want to be part of this community and help it navigate some of those same issues. And if you know me, you know I've spent time, about 9 months, working with the nursing homes in COVID prevention and management. And thank you. And we, by bringing them together in collaboration rather than allowing them to fight that battle alone, they are 6 fairly independent, isolated businesses or on the end of a small system. They were very much at risk. They weren't supported by large health systems or other infrastructure. And we knew that it would devastate this community if we didn't come together with the health department and work together on COVID. And we actually achieved a rate of COVID death in Transylvania County 16.4% below the state average because we did it together. That was an important learning for me. And then we encountered the youth mental health crisis, and many of you know that I've been very involved with TC Strong, and we're fighting a similarly life and death battle. So when I look at this, I call it now the one big barbaric bill. We'll all have our names for it before the day is done. And barbaric came to mind because there's nothing beautiful about it. It's mean, it's cruel, and it seems intentional. So when I thought about standing here and talking to you tonight about this really monstrously complicated bill laid over a monstrously complicated system of US healthcare, both of which can be incredibly harshly arbitrary, can be less than compassionate, can not meet the intent we ought to be able to expect our healthcare systems to meet. I needed a place of moral firmness, of grounding, so I didn't get lost in the details. Dr. Hudspeth done a masterful job of boiling down the numbers and the facts and the impacts in a quantifiable and I think understandable fashion. I'm going to look at it through a little different lens, and it's more of a moral lens. So the quote that helped me do that was this: "The moral test of government is how the government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped." Double bonus points, you get more treats if you know who said that. I would be amazed if somebody, I had to look it up, I had no idea. It was Hubert Humphrey, 1977. And it underscored his commitment to social justice and what he believed in. And I love that quote. And I think it has bearing on where we are today. So I'm not going to talk much more about the numbers, except maybe I'll throw in a few about Transylvania County here and there. But I do want to talk, I picked areas that I felt represented that quote and that I've been drawn to in this community to think about how this was going to impact us here in Transylvania County as a community. If I substitute the word community for government in that last quote, it's an important way to look at how we all come together as a community, what we tolerate from those who lead us, what we tolerate from each other. And I really think Hubert Humphrey's words are helpful in that. So I want to talk about 3 areas: pediatrics, the young, mental health for all of us, and nursing home, a little bit more specifically to our community. So I reached out to the primary pediatric provider in this community, Hendersonville Pediatrics. And Aura's with here tonight. And I got to tell you, I don't know if you all realize what a gem we have in Aura and in Hendersonville Pediatrics. I've never seen a pediatric practice that was so deeply committed to this community, that delivered such incredibly high quality care, and was always doing the right thing above and beyond seeing patients in front of them. That practice, the usual pediatric practice in North Carolina, has about 42% Medicaid patients. Hendersonville Pediatrics has about 2/3. So by their own self-report, when I spoke to their practice manager, almost 2/3 of their patients are Medicaid. So again, it attests to the character, it attests that they meet the need in the community, and also attests to their vulnerability. And as Dr. Hudspeth said, this October, they are, Hendersonville Peds, as outpatient billing physicians, are subject to an 8% drop in their reimbursement rate. Just because our state didn't adequately resource Medicaid. So because of that shortfall, that's an automatic trigger. That's before we get to any of the impacts of the BBB that Dr. Hudspeth already also talked about. So they're going to wait for that till after the midterm election for most of that to hit. But you've already got a group that is in private practice with a low margin, deeply committed to their community, subjected to an 8% price reduction with everything else going on. Their staff live in this community. How's housing costs around? How's food costs? How is it for their overhead? It's going up. It's not dropping 8%. So we have that group, which has been so deeply committed, not being treated well by the payment system and the government, quite frankly, but I want to make sure I say this, and I promised them I would. Here's a quote from one of their providers: "We're less concerned about any pay cut for us, the physicians, than what it means for our overall well-being, work-life balance for the providers, and thus our ability to care for our patients the way we want to." So they said they're not going anywhere, but they're concerned about that. They're concerned about the ability to recruit new providers in who may be able to get better, will be able to get better paying jobs elsewhere, and who don't carry with them that commitment to our community. So there's the financial impact, and then there's the survivability and the need for us to recognize how important they are to this community when they take care of the bulk of our kids and they're being buffeted. So I'll leave that there. Next, mental health. Dr. Hudspeth is just no longer the chief exec of Blue Ridge Health. When I moved here in 2017, I chose a PCP, and it's Macy Ladder, and I chose her because she's also a wonderful human being, a good doc. I also chose her because she was on staff at Blue Ridge Health. And I didn't know much when I got here about Blue Ridge Health per se, the strength of their leadership, for example. But I believe strongly in the F2HC model. Federally qualified health centers is a funding construct through which an organization like Blue Ridge Health can receive much higher reimbursement for the services they provide, in return for which they are obligated to provide critical primary care, dental, and mental health resources to that community, regardless of cost. If you don't have insurance and you don't have a lot of resource, it's a sliding scale. So financial barriers, you can never say non-existent, but they are minimized in that model. And I believed in it so much I didn't look for a physician anywhere else. That's where I wanted to get my care because that's what I wanted to support in my community. And I have some good news. This has all been tough news tonight, so let me lighten the mood a little bit. Pardee is making big moves into this community. You see the building going on there. Pardee's primary care network, 11 clinics, primary care clinics, are now operating under F2HC tenet and model as a subrecipient of Blue Ridge's license. So they are working well together, and they are increasing the resources in this community in those three critical areas. They've hired on an outpatient mental health medical director, Dr. Maggie Shirley. She's amazing. She lives here in Brevard. We help them help Pardee find her. They've hired a new inpatient psychiatry lead. They are opening 16 adolescent beds this fall, knock on wood, and they will continue to ramp that up by 16s until they meet the need. Given my heart for youth mental health, having increased capacity for adolescent inpatient beds without having to have the sheriff drive some of these kids across the state or out of state is profoundly important. So we're on this is Tale of Two Cities stuff. We have some wonderfully new resources. We have two organizations working hand in hand under that FQHC model to increase the things that we know statistically improve the overall health and well-being, the longevity, the health of our community through the FQHC model. And that is going to be under duress. And I don't think any of us know how much this will end up eroding the FQHC model and interfering with its ability to provide critical care for communities like ours. It's an unknown at this point, as far as I could tell. So good news, we have some new mental health resources coming in. Tougher news is the methodology that's providing that for us in a rural community could end up being at stake somewhere. If we continue down this path, logic would say there is a prescription pharmacy purchasing pricing arrangement called 340B pricing that helps underwrite this, as well as the increased reimbursement for services. Those things could all be changing at some point down the line. That's something we have to keep our eye out for. It would deeply impact this community and others like us. Lastly, the nursing homes. We have 6 fairly independent or tail end, rural end of small chain nursing homes in this community. Learned a lot about them during COVID. We have very dedicated people taking care of our elderly there. And Medicaid funding provides for about 60% of all nursing home care. And that impact on these relatively, I don't want to say isolated, they're unsupported by major health system resource. So they have relatively light infrastructure. In a rural environment, that's going to be a tough sell. And you heard from Dan the statistics on the overall closure possibilities for nursing homes. So that we have to understand is very much at risk in our community. So about 20% of nursing homes could close and over 50% would reduce staff. Okay, I got to pause there. What we learned in COVID about the likelihood of people to die in nursing homes under the stress of COVID was there was one factor that was statistically predictive, and it wasn't compliance with CDC checklists, it was staffing level. Staffing level. So again, it isn't just the closing, it's that attritional loss of a healthy staffing level. The last thing I want to do is to talk, as Dr. Hudspeth did, briefly about SNAP and food. We learn in healthcare that, you know, the social determinants of health are those things that influence health outside of the office, the clinical practice of medicine. And we kind of, I think in the course of our careers, came to understand that that's more than 60% of overall health and well-being. Numbers are somewhere in there. It's the majority. And it's about food security. It's about housing. It's about safe places to play outside if you're kids and exercise if you're adults. And if you don't have those things, your health will suffer. We have 4,026 people in Transylvania County who receive SNAP benefit. 1 in 6 children across the state of North Carolina receive SNAP benefit. Do we have to ask our kids if they're deserving of eating? $180 billion reduction in federal SNAP benefit. Barbaric. And I want to close with a story. For me, it's deeply personal. In my role as a chief exec, I had a lady ask to meet me one day, and she was suffering from stage 4 ovarian cancer. And she sat across the desk from me in tears, not because she was dying. What she came to talk to me about was her fear of bankrupting her family. We are the only first world country, by the OECD's estimation, not just mine, that does not provide universal health care without economic risk. Is it something we deserve? Is it something that we can afford? Absolutely. And to me, the takeaway as I dove into all these aspects of the big barbaric bill and looked at it from a policy and payment standpoint and from a community standpoint was this is moving us significantly incrementally away from that principle of universal health care as a right and as an obligation to a moral society. Thanks.
I have to say, what an honor and a privilege to be on a panel with Dr. Emaus and Dr. Hudspeth, and I'm sitting here writing in my notebook. As a reporter, my instincts are kicking in, saying, "Oh, that's a story. That's a story. That's a story." So I promise to steal their cell phones from them and potentially bug them in the future if they'll have me. So. My name is Andrew Jones. I'm an investigative reporter with Asheville Watchdog. By happenstance, I became a healthcare reporter, and that is largely because I did healthcare work at the Citizen Times before I started with the Watchdog. There were some, pretty acute needs in our community as far as healthcare goes, and so I decided to focus on that, and that has sort of spun off into a whole universe for me, where I end up speaking and writing a lot about healthcare all over this region. But we do focus primarily on Asheville and on Buncombe County, although what happens in Asheville and Buncombe County really does impact the rest of Western North Carolina, and that's specifically because of a company that I'm going to spend a lot of time talking about today, that is HCA Healthcare. HCA Healthcare, let me say, I talk with people who work for that company every single day. Obviously, they own Mission Health in all the hospitals, in most of the hospitals in this region. And what amazing doctors and nurses, some of the most remarkable and adept healthcare professionals that I have ever met. And I am so thankful for the work they do in our communities. They do it under the duress of a company that is not always above board, and that's kind of putting it lightly. And what they are facing in this kind of environment that they work in is a lot of cuts and a lot of deficits that they did not face before so acutely when Mission Health was an independent nonprofit. And so I'm going to talk a lot about that subject material, reflecting on something. And I guess I was thinking about this as I was driving over, is, what are these deficits in Medicaid going to mean for our hospital system? And my main takeaway from it is that we have a hospital system that has already been weakened by cuts. The concern that I have as a reporter, and the concern that my sources have, and the concerns that I'm hearing from these doctors, is that we could potentially further weaken our hospital system if we see these cuts move through. Again, there's a lot of uncertainty around it. We hope for the best, but we fear for the worst. My contention is, and I'll pull up the slide right here to say it, is that we cannot have healthy communities without healthy hospitals. The more that hospital business is done behind closed doors, the higher there is the potential that communities will be less healthy, quite literally. And so I kind of see my work that I do, not as a healthcare professional. I know very little about healthcare, and I'm so thankful to everybody who helps me fill in the gaps of that knowledge, is that if we conduct healthcare behind closed doors, if we conduct the business of healthcare behind closed doors, that hurts people. And so I am dedicated to transparency and bringing those conversations that are behind doors to light. And I believe that good journalism can and has exposed how care fails, how it falls apart when profits come first. So a quick summary of kind of where we are at. As many of you know, HCA Healthcare bought Mission Health for $1.5 billion in 2000. transforming it from a nonprofit system to a for-profit system. And so now we have these 6 hospitals in rural and urban Appalachia and Western North Carolina that were bought, transforms it, and the deal that happened back then kind of seemed kosher from the time, but now we know that it was rancid, if not rotten. The nonprofit CEO used close connections and friendships to attract and seal the deal with HCA, and the community and the board members and elected officials, many of them now feel, according to the reporting that we've done, as though they were sold a bill of goods. Immediately after HCA took over, it began to prune resources and staff, and then COVID hit. So when I hear from Dr. Emaus that, the most important thing to understand about COVID and what caused the most death is staffing, I hear that from nurses all the time. We're still talking about COVID to this day, and how, for instance, one nurse told me, we used to have a ratio of like 3 to 1, 3 nurses to 1 patient, or 4 nurses to 1 patient. During COVID, that went up to 5 to 1, and now in a specific wing of the cardiac unit, it's still that, right? And nurses are really, really concerned about that. So what I get concerned about when I write is, like, how does a broken healthcare system chase away great healthcare providers? And so I talk to a lot of doctors who have decided that they can't be part of the largest healthcare system in the region. Remember, this is the largest employer. I believe they say that they employ about 12,000 employees across the hospitals that they own. Many of those people have felt uncomfortable in their work environments and have decided to leave, and that includes, according to some reporting that I did last year, 660 nurses over 2022 and 2023, and at least 200 doctors have exited the HCA system. And I know you here in Transylvania have felt the impact of that as well. So HCA's deep pockets kind of sustained the hospital throughout the pandemic. They still found ways to cut. Certain practice groups were decimated. There was a union that was formed. There was a mass exodus of healthcare providers. And my reporting kind of focuses on the fallout of that, and specifically of staffing decreases. There's belt tightening that's happened, and it's led to lack of communication, cheap contracts, burned relationships, and ultimately the North Carolina Attorney General's frustration with HCA, because he was one of the overseers of the sale, led to him suing HCA at the end of 2023. And right after that, we had state and federal investigators who had not shown up before when nurses were complaining about issues at Mission Hospital. They saw some of our reporting on communication issues, and they launched an investigation into the emergency and oncology departments there. What they found was that patients were in danger, including folks from here in Transylvania. I met a woman who I don't name in my reporting, but I call her patient 12. She had appendicitis. It took 12 hours from her to get here to a place where she could get treated at Mission Hospital. And along the way, she got a needless pregnancy test. She ended up being in a federal record that I obtained, and we had an amazing conversation about how her life has changed. In response to being sued, HCA looked at Stein and said, we never really committed to quality care at Mission, which has been a big frustration to a lot of people. And of course, over the years, that has led to a lot of legal issues as well. One of them just settled by the city of Brevard for a number of reasons. Yeah, right? I was looking for Maureen's face. She's spoken a lot to me through the years about how this case has gone. And so I think the thing that we've been most concerned about is that in 2023, after that investigation, the hospital was put into immediate jeopardy, which threatened its Medicaid and Medicare funding, which it's the worst sanction that any hospital can undergo. And it happened because 4 people had died and 14 people were harmed as a result of lack of adherence to federal standards of care. And so we've tried to continue our reporting on what's happening over at Mission Hospital, which is, the primary facility that I report on. We talk about lawsuits, we talk about breaking news that happens, we talk about management, and we talk about really frustrating things that happen there. For instance, an investigation that I did just a few months ago found that 100 deceased people were released from the hospital before there was a legally required review. I recently wrote about a man who stayed 4 years in the hospital. The hospital sued him for trespass to try to get him removed, which eventually they were successful at. So all that context is what I'm thinking of when I think of how our hospital system could be impacted by Medicaid and Medicaid cuts. And I was really shocked when it happened, but I had a source from inside the Assembly, General Assembly, leak me a document that showed exactly what General Assembly members were being told about what would happen. And this is a summary of it. Some of it you've heard from these doctors already. The state's rural hospitals will lose about $3.7 billion in Medicaid. More than 70% of that loss is coming from cuts to hospital expenditures. The North Carolina Department of Health and Human Services has announced that it will begin preparing to submit its application to receive funding from the $50 billion Rural Health Transformation Program, which Dr. Hudspeth mentioned. We don't know how that will turn out. North Carolina's rural population is the second largest in the country, behind only Texas. And when I reached out to various hospitals, I got various responses about how this could impact them. HCA would not talk to me about what the projections are as far as what they will lose, but I did hear from a couple of other folks who I wanted to highlight here. First, Dr. Bill Hathaway over at MAHEC, he said that while the full impact of this legislation is still being assessed, we are deeply concerned about the projected reductions in Medicaid and SNAP funding, both of which are lifelines for many patients and the families that we serve. Susan Mims at Dogwood Health Trust, which kind of oversees healthcare improvement and education as far as research across the region, says, we are concerned about this bill's impact on the health and well-being of children and families, on local economies, and on the financial health and sustainability of rural hospitals in our region. And James Kirby, who's president and CEO at UNC Health Part E, said, we do not feel it's appropriate to speculate without any specificity on how the bill will ultimately affect UNC Health Part E. So what I'm looking at in my reporting right now is a great deal of uncertainty around what will happen. And yet, at the same time, I'm hearing from providers across the region that they're incredibly afraid about what will happen to their patients. And specifically from those who work inside HCA, where resources have been trimmed and staff have been trimmed, the question is whether the hospital will kind of be impacted by these cuts in such a way that they will have to continue to trim staff and resources. We don't know what that looks like yet. However, I did hear some encouraging news today that I have yet to report, and that is that our local hospital is aiming to hire about 200 more people onto its staff, 100 nurses and 100 techs. And so we will see exactly how these cuts impact Mission Hospital. But we are looking forward to hearing from the community and from providers about exactly how that plays out. So, thank you.
Thank you, Andrew. And thank all the panelists. It was really great. Thank you so much. There's a lot of great questions here, and want to reserve a little bit of time, and maybe Scott, you give me a heads up when it's 5 minutes in case I get lost in these great questions. Some are kind of high level, and some are in a bit more detailed. I'm going to start with some high level ones. What, if any, leverage or influence does a city or county government have to change the arc of this narrative?
I'll take first stab
Be
and
direct with that.
let these gentlemen follow up. I think Mayor Maureen gave us a wonderful example of what local government can do to give voice to the concerns of the community. That's on a significant scale. To take on HCA is not nothing. But what will be required of us to have an impact on the things we've been talking about here tonight, state and federal funding policy levels and priorities, will take, multiples of that. It will take all of us grassroots from the community levels coming together, and it will take 1,000 brevards, and we have to fight that battle. And our local government and leaders have to join in that level. And I would certainly encourage and welcome that type of action from both our city government and our county government here in Transylvania County.
I'll say that I just did a story about the Health and Human Services Department working with the Economic Services Department in Buncombe County. And they did a presentation, the Economic Services Department did a presentation with the Health and Human Services Department and just sort of outlined what the specific impacts of the bill would be at the Buncombe County level, right? And I found it very encouraging that they were starting that conversation early on rather than waiting. But the biggest thing that I got from them was we really need guidance from the General Assembly about what to do next. If we don't get that guidance, then we're going to be flying blind. And specifically, that's because, if any of you have ever worked in local government, you know that you start planning your next year's budget 100 years before it starts, right? And so local governments are trying to, budget for next year and the year after that. And that's something that's difficult to do unless they get guidance from the General Assembly. And so one would really hope that legislators are working to give guidance to local health departments and local economic services departments as these changes are made.
I would just add, guidance is one thing, but as it's like a hot potato. Federal government cuts money, passes the cost down to the states. The states are going to pass the cost on to counties. One good example of that is around work requirements. That usually eligibility in Medicaid generally falls to DSS in each county. And so already some of the Medicaid cuts, I told you about the $319 million, they're already underfunding other administrative costs. So we can only imagine those costs that are going to be borne by the counties in order to process these work requirements. Now, CMS is putting out, I believe it's in June of next year, what these requirements are going to look like. And so we're going to have to figure that out. And how are we going to pay for that? The other thing I wanted to mention, because it was mentioned earlier about the trigger law, any increase in costs over above what we said the federal share was, will automatically end Medicaid. So as these administrative costs get higher to the states and to the counties, that could potentially trigger that Medicaid expansion is over unless they do something specifically around that particular instance. So there are ramifications and implications of all of these things that can happen.
So the arc of
The
this
next question,
narrative, especially with HCA and since the move to HCA several years ago, the arc of this narrative has been somewhat poor anyway, and the big beautiful bill is threatening it even more. Could Transylvania Regional Hospital fail? Be closed, that is?
Well, I can't, can you all hear me okay? So I personally can't speak about whatever the financial arrangement there is with Transylvania. I think all rural hospitals in North Carolina are at risk. And those that are most at risk are those that are probably in the most difficult situations. So I don't specifically know where Transylvania Regional Hospital sits with that. I thought part of the settlement, though, was that HCA had to continue operations for 3 more years. Right. But not, Andrew, I think you said, but not quality services for 3 more years, just services. So I'm not sure what that means.
Well, and the quality of service is one issue, and array of services, and is that meeting the health needs of the community is a completely different question. So they've committed to keeping it open, and the original terms of the sale were so vaguely written, it allowed them to do the things they've done. I have concern that staying open is not close to being synonymous to meeting the needs of the community. What they provide in that hospital, and I want to acknowledge, just like you said, with it's heroic to watch caring clinicians work in an adverse environment. It in a way brings out the best in humanity, and it should never have to happen. But I feel that way about some of our people that work in Transylvania Regional Hospital. Wonderful people trying to deliver great care under really hard circumstances, and I don't think it's going to get any easier.
Yeah, I mean, hospitals are expensive to run, and as I understand it, they're getting more expensive to run. Supplies, staff, just the cost of living, for instance, in this region is not simple and straightforward. And so that's going to, I think that's going to put pressure and make belt tightening on the back end that I am worried about. I guess, I want all hospitals, I want especially rural hospitals, to have thriving and resource rich environments. But I am concerned that, and I think it's complicated the way that you get to this, but I'm concerned that Medicaid cuts are going to lead directly to cuts that say we can't buy new equipment this year. We cannot hire that phlebotomist. We can't, we can't repave the parking lot, and all of these things, these quality of work environment and these quality of care matters are very, very important. And so, again, it's difficult to see how all this plays out, but this trigger, potentially ending Medicaid expansion could, it could put a real dent in the ultimate quality that we see at hospitals.
And staying on that about the regional hospitals, I think this is for Andrew. Can you talk about the ongoing wars between Advent Health and HCA for new hospitals?
Yeah, the Star Wars of hospitals. Yeah, I guess I think of this also in context of Medicaid cuts, even though this is a little bit more of a legislative thing. There's this complex and convoluted thing called the Certificate of Need Law. And the Certificate of Need Law essentially allows for competition to happen when new healthcare, when new healthcare things come into our community. So for instance, Advent, Party, and Mission right now are all competing for a new PET scanner in this region. And so Certificate of Need laws are, back in 2022, Advent and Advent and Novant and Mission Health all applied for 67 new beds in the region, acute care beds. And Novant and Advent said they wanted to build entirely new hospitals, which would bring a little bit more diversity of hospital care to our region. Advent was ultimately awarded those beds, but it has been in a consistent legal battle with Mission and briefly with Novant. Ever since 2022, that legal battle is delaying the building of Advent Health's new hospital, they kept applying for beds, and they won 26 more. So now they're going to build a 93-bed hospital. They're about to apply for more beds, which would make that hospital a 222-bed acute care hospital. But that legal battle, which has now gone as far as the Supreme Court of North Carolina, is kind of a roadblock in many ways. And the reason that legal battle is happening is because Mission Health, HCA Healthcare, is essentially saying, well, we didn't get our due process in the process of getting these beds. And so North Carolina Department of Health and Human Services, specifically the Division of Health Service Resources, you need to reconsider this awarding of beds. And I think that's frustrating a lot of our community members because they believe that we need diversity in the types of healthcare that we have in this region. The whole reason that there was a lawsuit that came out of Brevard in the first place is because Mission had so much power, its market share was so large. And essentially, one of the arguments of that lawsuit was, this doesn't allow the employees of our government to have options when it comes to health insurance. So people ask me this question all the time, like, when is this battle going to end? The answer is, like, I don't know, because there is no end in sight right now. And as far as we know, the healthcare services that we have right now are what we're going to have for the foreseeable future. Again, we have remarkable doctors, we have remarkable clinicians, we have remarkable nurses in this region, but I think there's definitely a feel that we need more competition in order to attract more talent to this region right now.
I'm going to quicken the pace just a little bit as we near closing with a quick question and then a special request. In spite of the damage that the bill will do, is the Hill-Burton Act still alive? This is the act that that you're able to get emergency care. You can't refuse emergency care to a person. Is that being impacted in any way, the Hill-Burton Act?
Well, and most of us, I think, clinically, we refer to EMTALA as that set of laws and requirements that require that you never turn away someone in an emergency circumstance. And I've not heard, read, or understood anything that indicates a potential change to that.
And then a follow-up to that with perhaps some remarks about how inefficient of a healthcare system is emergency care in terms of cost and...
Well, I'll start that discussion. The best value in healthcare is primary and preventive services. It's just simple. And the less we invest in that and make that available, accessible, without boundaries, barriers, economic or otherwise, the more we pay. It's getting your oil changed in your car. Pay me now or pay me later, and it's more expensive to change an engine. So it's no different in healthcare.
Amen. And then a special request for Rik Emaus, if you could requote the Hubert Humphrey, that might be a nice close. And then to you, Scott. And thanks, everyone.
Thank you. I'd be happy to. The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped.
How about a round of applause for our panelists? Okay. We're going to try to get to the unanswered questions, many of them online on our webpage, if we can, right, as much as we can. Also know that TPD will be working to create a petition and organize presence at a county commissioner and city council probably about these questions. We want to be present and to bring these issues forward. We'll be leading the charge on that or trying to. So we're going to be organizing that. If you want to be involved in that, go to our webpage, contact us via our webpage, and let us know that you want to be involved in that. And we'll be looking for volunteers to show up. And sometimes that's what it's all about, is just the number of people showing up about this issue. The last thing I'll leave you with is what we're going to be doing next. And a little bit of a preview. We haven't finalized it completely. So we'll be doing, as you might expect, an event around the Constitution. Constitution Day is on September 19th. And we know the city and county are doing stuff about the Constitution. So in the following week, time and place to be decided, we will be holding a special speaker who will be coming in to talk about the history of constitutional issues associated with presidential power. So you can imagine what that might be about. So that'll be coming in September, and look for that in your email, in the newspaper, and any other place, and the radio. Listen for it on the radio. Okay, thank you for coming, everyone.